The doctor of 1904 Texas was vastly different from the modern professional we know today. Few maintained offices, and even fewer had nurses to help them with their patients. Working from their homes, their residence was the closest thing to both hospital and pharmacy, though in most cases, doctors went to their patients, not the other way around. Dr. W.V. Cranford came to Buffalo Gap in 1887 as one of those early physicians. In 1923, he reflected upon what a modern doctor might call making his rounds.
I used to ride 30 or 40 miles across country without even a path to see a patient. Sometimes it took 2 or 3 days to make a trip. I've split open more cold nights than any man in the county. I never want to go back to the old days.
Once at a patient's home, men like Dr. Cranford did whatever they could to cure them. Carrying his medical bag full of powders and liquids, he frequently mixed medicines on site, as a round trip back to the doctor's office could mean the difference between life and death.
First, he would add the mixture, shake the bottle, then turn it up and taste it. This troubled my mother when he did this at our house. She considered it unsanitary, but she felt less apprehension in giving the medicine since he had tasted it.
Once the patient was on their way to recovery, the doctor calculated his fee. Visits to the office might cost as much as $1.50, with house calls set at $3 and night calls as high as $5. Fees for delivering babies rarely exceeded $25. However, if a patient was short of cash, many doctors would accept work in kind, livestock, or food in exchange for their services. Back at home, doctors might see to an occasional patient, but more often they tried to get ready for the next house call. Some might review a cherished copy of Gray's Anatomy, first published in 1858, and the standard work on human physiology. Others restocked their medicine bags, making use of a well-stocked medical storeroom, or ordered replacement supplies through the mail from the Park Davis Pharmaceutical House. Regardless, the frontier doctor was a valued member of a local community. While he might not have a diploma from a prestigious medical school, his ability to ease one's pain and calm the afflicted earned him the respect of almost any frontier Texan.